This program is supported in part by a grant from the Coronavirus Response Fund.
Hi, I'm Dr. Angela Sims. I'm a child psychologist and I direct the Children's Center, the Sarah T. Butler Children's Center for the Pastoral Institute. And I'm going to talk to you today about mental health issues in children and how you can identify those in your child and when and how to seek help. So first I want to just say that all children have up and down behaviors. One day doesn't necessarily mean that the child has a mental health problem. But if you have continued problems, then there may be reason for concern. Right now with COVID, more and more children and adults are feeling stress, anxiety, depression, and at times suicidal thoughts. So if you see an increase in those, that might be a good time to start seeking some counseling for your child and or yourself. We have lots of counselors here at the Pastoral Institute that can work with you and your family. So some of the things that we look for when we're thinking about children's mental health concerns is with young children, we will look for things like if they're not speaking words by age 2 or full phrases by age 3. If your child doesn't sleep regularly after age 2, or there's a change in their sleep pattern, like they had been sleeping and then they stop. If they have lots of nightmares or night terrors. And night terrors are pretty common for children, young children from about age 3 or 4 to about age 6 or so. But if they continue to have them past that, or if they're having them every night, that might be a good time to go ahead and seek some help for that. Another issue could be your child's not eating. Maybe they only eat 1 or 2 foods or only drink milk and won't eat even solid foods. That might be another time to go ahead and have your pediatrician take a look at your child, see what's going on. Of course, if a child becomes overly aggressive with others, with other children, with other adults, with yourself, that would be a time to seek some counseling. And anytime a child says any kind of self-harm statements or engages in self-harm behaviors, even if they say things like they would be better off dead or they would be, they wish that they were dead, then you immediately want to seek counseling for that. Other things that we look for in children is maybe the teachers are reporting concerns that the child can't pay attention or keep their hands to themselves or stay seated. If their grades drop suddenly or they're just not able to make good grades, like they're starting off in first grade and the teacher's saying there's a lot of problems going on, or they've been going along and the grades have been fine and then you see this drop. That usually means something's going on. The child's having problems with school, maybe having some attention problems or learning problems. Another issue would be if you start seeing the child with a lot of sadness, discouraged, uninterested in doing things, don't want to go play, don't want to, engage. That can be some signs of depression. If your child's showing a lot of fears, anxiety, or starts having panic attacks, then that again would be a sign of concern. If your child has been toilet trained and then they start soiling or wetting themselves. Now, bedwetting's very common for a lot of children up to even pre-adolescence, but if they've been completely trained and then start wetting, that can be a concern. And of course, if a child says they're hearing or seeing things that others don't hear or see, then you want to get that checked out. This list I've gone through is not exhaustive, but it's certainly a place to start. And anytime you have concerns, you probably want to check with your primary care physician or pediatrician first to kind of do a screening for any kind of medical issues that might be going on, and then they can also do a quick screen for mental health issues and refer you to a counselor or psychologist for testing, evaluation if needed, and or counseling as needed. In each segment, I'm going to cover more in depth about different childhood disorders and how they manifest themselves, when to get an evaluation, what to look for, and treatment options.